Greetings from Izmir. My name is Halicioglu and I'm a PhD student at 22nd University. In the early days of the COVID-19 pandemic, as most of the people around the globe were feeling, I was very concerned about the uncertainty of the situation. This was keeping me from being motivated and productive, especially when it comes to my studies. One day I was thinking and this question came to my mind. What if my house was integrated with intelligent building systems? Would I work more productively? So this was the starting point of our study. Our study focuses on the mandatory working from home concept that is highly in need of ICT support for work productivity and occupant well-being, and in this context, the need for the intelligent building systems in residential buildings. For this study, I took the online course of COVID-19 and work, staying healthy and safe at work during the COVID-19 pandemic from the World Health Organization. There I learned there are 5 measures, which are physical distancing, cleaning hands, practicing respiratory hygiene, wearing a mask, and a good ventilation to ensure infection prevention and control in the workplace by carrying the hierarchy of controls framework into practice. Also encouraging working from home is the most effective way to protect employees, and it has become an almost mandatory implemented way of working globally. And soon after, the rates of the working from home have increased on a large scale for business to survive in a shaky economic environment, which needs agile and feasible solutions for the organizations and employees that had troubles adopting this relatively new way of working style in a short time. As in the age of information, working from home depends on information technologies usage heavily, and most of the employees prefer to work from home other than remote offices or working from home centers, even before the pandemic. This study focuses on mandatory working from home. A comprehensive literature review about the concepts of productivity, human health, well-being in the mandatory working from home context, and intelligent building systems is made. The benefits and the challenges of mandatory working from home are investigated, and right after the preventions for those challenges are presented. The relations between prevention criteria for physical and mental health challenges and functions or services of the intelligent building systems are examined to give recommendations about how these relationships can contribute to the productivity of the working life. So the second part of the study is all about working from home, which is a way of working outside of the business environment, providing environmental and economic benefits, and giving opportunities for a more comfortable work environment to the employees, especially who have disabilities, on the maternity leave or simply want to balance work and family life. Working from home is a risk mitigation strategy that enables organizations to ensure the continuation of vital services during extreme incidents such as natural disasters and pandemics. The term is synonymous with telework, remote work, virtual work, smart or smarter working, flexible working, anywhere working, and etc. During literature review, we found that the definitions of this concept are mostly about standard working from home. The concept can be summarized as a substitute way of working and a temporary or a permanent arrangement between organizations and employees outside traditional working environment, and thus relies on ICT, also preventing employees from commuting long distances. Standard working from home and mandatory working from home has 2 main differences. First is all about the arrangement between the organization and the employee, while the other is about the work performed remotely is full-time or part-time. As I mentioned before, new perspectives on digital transformation, empowering the employee's experience with safety, comfort, and both physically and mentally well-being, management of multifunctional and sustainable spaces and energy use, reducing operational costs, minimizing the cybersecurity risks are needed. Since the outbreak of the pandemic, there has been several scientific research on mandatory working from home using survey data of employers and employees all around the world. The results show that the effects of working from home changes according to the industry, type of occupation, the size of the organization, employee characteristics, and location. With the waves and the new variations, more and more organizations have been switching to hybrid models due to the demands of the employees who gain experience. Let's have a quick look at the benefits and the challenges of mandatory working from home for maintaining a good mental and physical health. In the next slides, the mental and physical health challenges and the actions to prevent these challenges are presented. Please note that these codes are short for preventions for mental health challenges. And these codes you see on the screen are shortened for preventions for physical health challenges. According to the information gained from scientific publications and commercial websites, the main systems of intelligent buildings and their functions, and also some examples for the subsystems affecting positively productivity, health, and well-being during mandatory working from home, are presented in the next slides. Integrated Building Management System is the system providing operational and analytical building functions that controls and monitors the other building systems connected. Information and Communication Network System is using web-enabled devices to connect the building occupants to the outer world safely. Heating, ventilation, and air conditioning control system is providing, controlling, and monitoring the indoor thermal comfort, humidity, air quality, and ventilation. Lighting system is adjusting the level of illumination and automatically conserving energy use. Safety and security system is using sensors, interfaces, and devices to keep the building occupants safe from harm by controlling and monitoring the systems automatically in case of unusual occasions. So the home automation system is for building occupants' free time activities and health status check. Vertical transportation system is basically the lift system that is equipped with alarm systems and to make sure the occupants get to their desired destination safely, comfortably, and fast. Fire protection system includes the sensors to detect the abnormalities in case of fire and ensure the rescue operation is successful. The relationship between intelligent building systems and health challenges according to the preventions for enhancing the productivity of mandatory working from home are as follows. Integrated building management system has no relation when it comes to mental health challenges. But for both maintaining work and life balance and minimizing cybersecurity risks, there are relations with smart heating systems and systems for energy saving. As a subsystem of Information and Communication Network System, VPN solutions are only related to minimizing cybersecurity risks, and smart multimedia systems can be used for preventions of maintaining work and life balance, getting under control of emotional exhaustion, and avoidance of social and professional isolation, as well as inhibit from musculoskeletal disorders and nutrition and hydration habits. As you can see, this system has no relation with preventions for mental health challenges, while it is related to indoor environment quality and avoidance of airborne and surface contaminants, maintaining a healthy sleeping routine, and COVID-19 infection. And preventions for mental challenges here are related to neither lighting system nor safety and security system. Lighting system is useful for inhibiting from musculoskeletal disorders and maintaining a healthy sleeping routine, while safety and security system is for indoor environment quality and avoidance of airborne and surface contaminants and COVID-19 infection. Home automation system is highly related to all of the preventions for health challenges except for minimizing cybersecurity risks. As you can see, fire protection system is not related to any of the preventions. And vertical transportation system is only affected on prevention of indoor environment quality and avoidance of airborne and surface contaminants, nutrition and hydration habits, and COVID-19 infection. According to the findings, the relevant intelligent building subsystems for health challenges and preventions are. And finally, here is the last part of our study. This review gives insight into the influence of the main intelligent building systems and their subsystems on the quality of life during mandatory working from home. You can find the examples of the preventions for mental and physical health challenges in our conference paper in detail. This study contributes to the literature by offering a functional view of the relationships between intelligent building systems and preventions for human health challenges during difficult times. It is also accommodated with the construction industry to consider the advantages of using up-to-date intelligent or smart systems in residential buildings to meet project success and add value to marketing. Thank you. Please feel free to ask questions and give us your feedback about our study. Have a nice day.